Now, one of the things we find is that often people have questions about where do they turn for services? Where do I turn if I have a family member and I need to understand more what they're going through? Where do I turn if I need some therapy or counseling? And what do I do if I'm really in an emergency, there's an emergency situation? So we brought in 3 speakers who can help answer those questions. And our first speaker is from the National Alliance on Mental Illness, or what we often just call NAMI, and that's Kate Fahrenholt, our executive director. So Kate, we're ready for you.
Always good to unmute. Thank you. So hello, everyone. I'm very, very glad to be here today. I'm Kate Fahrenholt, as Dan said, and I'm not always known for brevity, so bear with me as I try to stay in my time here. Next slide. Oh, you were on the right slide. Okay, sorry. The National Alliance on Mental Illness is the nation's largest grassroots mental health organization dedicated to, dedicated to building better lives for the millions of Americans affected by mental illness. And NAMI operates at the national, state, and local level. Next slide. NAMI Maryland is the official NAMI state organization in Maryland, and we support 11 local affiliates covering 19 Maryland counties, ranging from some with offices and small staff to all volunteer groups. You can access statewide and local NAMI programs and affiliates through NAMI Maryland's website or Warren line. Hold that thought. Next slide. So NAMI Maryland is a source of extensive outreach and provides free education, support, and advocacy for persons with mental illness, their families, and the wider community in person and through various media. Next slide. So 1 in 5 families have a close relative who has a serious mental illness, and my family is one of them. This is my sister, Vicki, on the left, and me on the right, about 2 years before Vicki started showing symptoms of a serious mental illness. More than 50 years ago, back when families, especially mothers, were still routinely blamed for the severe brain disorders of their relatives. And brain research was in its infancy, and certainly medication and treatment was too. My sister's journey has been a long, difficult, and frankly traumatic one for all of our family members, especially my sister. Time does not allow me to go into too much detail here. But back then, suffice it to say, there were no support groups, no one to turn to. Families and their ill family members felt isolated, and even if they didn't accept that they were somehow to blame for the illness, others did. And even those who didn't judge didn't know what to do. When someone has a heart attack, their neighbors, their friends, and family come together to provide meals, to run errands, to help get the family through. But even now, when mental illness strikes, other people can still be fearful or just ignorant, and they can often avoid or desert you without further education. Many years ago, when NAMI was first forming, my parents were lucky enough to hear about it through a concerned church member. And over the years, NAMI has helped my family cope with crises, negotiate the system, learn about the brain, new medicines, treatments, and coping skills. And because of this, my sister has survived. My parents found new friends and support, and I was able to lead my own life and help advocate for my sister. Volunteering and then working for NAMI to help develop peer support and education, to get people information and support, to advocate for effective and accessible treatment, and to give individuals and families hope has turned my family's trauma into positive action every day. Next slide. First. At NAMI Maryland, we develop and provide a wide range of free resources and programming statewide and nationally, including practical written materials, free recorded webinars, and multi-speaker conferences, etc., on topics for individuals, families, community members, and various specific audiences. We post all these resources, recorded resources, on our website. We've also helped develop and pilot and provide many different free NAMI programs. Some are on the slide. And we provide training for individual and family member volunteers to provide programs in Maryland. And I'll just highlight a few. NAMI Family to Family is a free 8-session education and skills course for families taught by intensively trained family members. NAMI Peer to Peer is an 8-session education and skills training for people with mental health conditions taught by intensively trained individuals living well with mental illness. Our NAMI Connection Recovery Support Group and our NAMI Family Support Group are both very structured, problem-solving peer support groups. Connection is for individuals, the other for families. Again, delivered by intensively trained peers. In NAMI and our voice presentations, trained individuals with mental illness tell their stories to educate the community, providers, and others living with mental illness. And we also offer more than 30 workshops by trained individual and family presenters on a wide range of topics for different audiences, from mental health in the workplace, basics about mental illness, what is recovery, to trainings on working with individuals and families for medical professionals, law enforcement, and community groups. We do a lot. Next slide. This slide speaks for itself. I won't spend too much time. Just to say, stigma is pervasive, it hurts, and it must be addressed. And individuals and families can be very effective educationists, and individuals and families can, with effective education and support, provide their expertise gained from lived experience. Next slide. So briefly, these experiences are traumatic, but we can transform our trauma into positive action. People who deliver our peer education and support and other outreach consistently tell us that it is transformative, seeing that they had something worth saying that others could and do learn from, and that they say that sharing also keeps them centered, hopeful, and supported. They came for help, and now they're helping others and themselves. Everybody is affected somehow. That's my other point. Next slide. How can you help? By raising awareness, by reducing stigma, by starting the conversation. The average delay between onset and seeking treatment for mental health illness symptoms is 10 to 11 years. That's why reducing stigma and raising awareness is so important. The earlier we recognize an issue and then seek, access, and stay in effective treatment, the better the outcomes. This year, NAMI is amplifying the message of Together for Mental Health, bringing all of our voices together to advocate for mental health and access to care. By starting and making it safe to have the conversation, by sharing personal stories with friends, family, and or on social media with the hashtag Together for MH, mental health, we can encourage people to prioritize their mental health, increase awareness about mental illness, and connect to support, education, and resources, including effective treatment. Next slide, please. Oh, I think I might have gotten in under my time. If you'd like to access our many free, practical, written and recorded resources, please feel free to go to our website at it's on the slide, sorry. And if you'd like to explore attending any of our peer-to-peer support groups or education courses, we have information on our website, but you can also contact us through the website at that email. And then I can put the phone number and for our warm line is on our website, but it is also, well, it's not on the slide. I will give it later or put it in the chat, 877-878-2371. And the next wonderful speakers are going to share more and different useful resources. Thank you. And I will put that all in the chat. Thank you.
All right. Thank you so much, Kate. And thank you for sharing the personal story. Those always mean so much. And thank you for staying within the time. We're hoping to have a few minutes after the next two speakers to field any questions. So if you do have questions, you can put those into the question and answer box again. Our next speaker is Amy Greensfelder, who is the Executive Director of the Pro Bono Counseling Project, a very special organization that's unusual, and Maryland is very fortunate to have it. So Amy, can you tell us about it?
Sure. And I'm also, Dan, this might be news to you. We, as of earlier this week, began using the name Pro Bono Counseling because at 30 years young, we decided that we had outgrown the project stage, that we are here to stay. So we're now Pro Bono Counseling, and we use the tagline, Your Mental Health Connection. Next slide, please. What we do at Pro Bono Counseling is connect people who are seeking mental health care and are having difficulty accessing counseling to licensed mental health providers who volunteer their time. We also offer a warm line. That's fine to be on the, maybe the one with the people. So if you go back to the one with the bubbles on it, the little yellow bubbles at the bottom. Oh, we're going all over the place. we could go backwards a few slides. There we go. Thank you. This is an overview of our, I'll get into the warm line in just a second, but our general services are connecting people who are experiencing experiences like what the previous speakers talked about with depression and anxiety, sadness, grief, stress. People who are wanting to make a change in their life can connect with our office, and we will connect folks to licensed mental health providers who volunteer their time. I see the chat in the chat box. Is it only for residents of Maryland? Yes, we as Dan mentioned, we're a rather unique program, and we're focused on Maryland. And if folks are calling from out of state, we often can connect them to resources in their state, but we do focus on all of our volunteer licensed mental health providers are in Maryland. And so the way it works is people call in to our office. The number is 410-825-1001. Our staff do a short confidential interview over the phone. And then from that interview, we're connecting folks on to licensed mental health providers who are volunteering. So there's no wait list, and those licensed mental health providers are able to provide free therapy, and we don't put a limit on the number of sessions that folks are able to access. Next slide, please. And to answer that question about who can connect, folks who are in Maryland, we work with individuals, couples, families, and children, and adults of all ages. Last year, we worked with people aged 4 to 94. So we serve all ages of people. Again, those common concerns: grief, sadness, family issues, stress, life transitions, anxiety, trauma. And we work with folks in a variety of situations around income and insurance. Sometimes people are uninsured. Sometimes people are underinsured, where you do have insurance, but you might be having a high deductible or high copays, or a limited network is making it difficult to access mental health care. And in all those situations, we would connect somebody to a volunteer for licensed for mental health counseling. Next slide, please. We also offer a service called the Warm Line. And you can go on to the next slide, please. I want to make sure I honor the time commitment. That again is for Marylanders. Very similar issues that people are experiencing and calling the Warm Line, but this is for brief phone-based support. So this is if you're experiencing worries and you just want to talk to a mental health counselor on the phone, you can call the Warm Line, and you would get access directly to a mental health provider. It's open weekdays, 10 a.m. to 8 p.m., weekends 10 a.m. to 6 p.m. There's bilingual staff on that line, and our regular line as well. And that gets you, you can connect to a mental health professional for brief support right there in the moment. Next slide, please. The number for that Warm Line is 410-598-0234. And again, they get the short mental health conversation with a licensed provider. And if services are needed beyond that, the Warm Line specialist connects the caller on to additional services. And then we also, if the person wants, we'll call them back in about a week just to check in and see how they're doing, and just check in again with them. Next slide, please. Just to provide a little differentiation, I know we've talked about a lot of services today. That Warm Line is really for folks experiencing stress, anxiety, sadness, and want to talk to somebody about those feelings and might not be in a position to engage in ongoing counseling. And then our regular pro bono counseling services are available for those folks who are looking to meet with a counselor on an extended basis for multiple sessions. And crisis has been mentioned a few times today, and just wanted to flag that if somebody has an active mental health concerned about harming self or others, maybe has medication needs or substance use disorders, we want to get that person connected up to crisis services, which I know Dan's going to talk to in a moment. Next slide, please. And I also wanted to share with you that we have, if you want to learn more about pro bono counseling and support our work, we do have an event coming up on Saturday, May 14th. For those of you in the audience that are licensed mental health providers, we are offering continuing education for that. We have a lot of great speakers. There's a community fair component to it too. So you can check out our website at probonocounseling.org to register for that event. Great for moving on to that next slide, because those are the phone numbers again. Website information there, probonocounseling.org. And last slide is our social media. And as I say on the radio, I'll take my comments off the air and hand it over to the next speaker.
All right, well, thank you. And boy, this is great. Everyone's staying within their time limits. So I appreciate that. Our next speaker is Dan Rabbit from Behavioral Health System Baltimore, where he is Policy Director for the Greater Baltimore Regency Integrated Crisis System, or what's often now referred to simply as GBRICS. And so this is an exciting development for our community. So Dan, looking forward to hearing your presentation.
Sure, thanks, Dr. Hale, and good afternoon, everyone. My name is Dan Rabbit with Behavioral Health System Baltimore. I wanted to speak with you today about an upcoming transition that's occurring in the world of mental health, which is the launch of 988, which is a new 3-digit number that residents and community members can use to access the crisis services that Amy mentioned just a moment ago. If folks remember at the top of the meeting, Dr. Hale mentioned the suicide prevention lifeline, and you put a 10-digit number up on the screen. I bet most people here don't remember what that number is now. And I think the recognition that a 10-digit number, 1-800-273-TALK, might be a little bit too much to remember in a period of intense emotional distress, of suicidal thoughts, of like chaos and overwhelm in your life. And so in recognition of that, the National Suicide Prevention Lifeline is transitioning to this new number, 988, and Maryland and every state in the nation is preparing for that launch. So I wanted to share a little bit about it today. Next slide. So in moving to 988, first thing really important to mention is that this transition doesn't happen until July 16th of 2022. So this is sort of a future resource, is this easy to remember number. Up until then and beyond then, that 10-digit 1-800 number that Dr. Hale mentioned will continue. Maryland also has its own crisis 3-digit number, which is 211. You have the opportunity to press 1 when you dial that. And one thing I realized I should have put in these slides that I didn't, but I'm going to drop in the chat real quick, is Baltimore City has its own hotline that is active now and has been active and is run by Baltimore Crisis Response Incorporated, BCRI. But the 10-digit number for that, it's a 410 number for city residents. I just dropped in the chat. And so 988, that's a resource for July 16th and beyond. But there are resources, many of which have been discussed already today, to help folks who are in crisis. But when we transition to 988, it really is an opportunity to really lift up the importance of seeking help if you're experiencing a mental health crisis or emotional distress and overwhelmed that you don't know how to handle on your own. Everyone knows 911. And 911 can be an access point to mental health services, but that's not really what it's designed for. An ambulance or a patrol officer or a fire truck, none of those professionals or those interventions are really designed to help people struggling with mental health issues. 988 will be a 3-digit number that is accessible throughout the country, and that we hope one day will be as well known as 911. That if you have a public safety emergency, a medical emergency, a fire emergency, you call 911. If you're having a mental health crisis or substance use related challenge, you can call 988. 988 will be 24/7. It's confidential. It's free. It's accessible anywhere in the nation. And like I said, it's not a brand new thing. It's a new number for an existing network of that serves the National Suicide Prevention Lifeline. Next slide. So the way that it works when you call 988 or when you call 1-800-273-TALK today, is you will receive one prompt, which will ask you if you're a veteran or if you would prefer to speak in Spanish. But besides that, and you'll just be put into the routing system, and you'll be it's a national routing system, but it's made up of local network of local call centers. And so you will be diverted to the local call center that is most appropriate based on where you're calling from. And so, so this is the map of the different call centers that we have in Maryland. Maryland has a good network already in preparation for the transition to 988. Where the state is not anticipating adding any new centers, but we are hoping to staff up a lot of these centers so that people can get their calls answered more promptly. And we're also looking to build out more additional resources, whether that's urgent care appointments to community behavioral health services, or mobile community response teams that can go out into the community and meet with someone who's having a particularly difficult time, or whether that's in-person stabilization centers where people can go that are more well suited to serve someone experiencing emotional distress than the busy, chaotic scene of a hospital emergency room. So we're hoping to build out that network, but these call centers on the screen are the ones that will be the ones answering the call for 988. Should also mention 988, it's traditionally talked about as a phone line, but there is text and chat capability. Right now, only 3 of these 8 centers offer that service. The 3 with the asterisks there, but we're hoping to see that expand soon. Next slide. For providers on the call, I've been talking about this as a resource for yourself, but I think it's important to recognize that this is a well-kept secret that Congress passed this law to establish this new number, and that people in the mental health industry are looking to this as an opportunity to address the stigma around seeking mental health support. But very few people outside of the mental health world know this. So we're looking to partners to help us, especially after that July 16th launch date, to raise awareness of this new, more accessible, easy to remember number. Most people haven't heard of it as of today. Next slide. And so as partners, if you're a provider or a community group, we ask that if you're providing people with resources, that until July 16th, we're not directing people to call 988. We're having them continue to use the 10-digit number that Dr. Hale said at the top, or here in Baltimore City, we're still using this 410-433-5175 here to help hotline number. But after July, we would love to work with folks in promoting 988. At Behavioral Health System Baltimore, we're going to be participating in a promotional campaign and a public awareness campaign, and we expect partners around the state and the Substance Abuse Mental Health Services Administration, SAMHSA, to do something similar. So more to come there. Next slide. So this, as Dr. Hale mentioned, I also work as part of the Greater Baltimore Regional Integrated Crisis System on that project. And that's a project that's related to 988 and is related to expanding and strengthening our crisis response system. And as part of that, we've met with a lot of community groups to talk to them about 988 and about GBRICS. And this is one quote that shows that people are excited. Hopefully many of you are excited to hear about this new resource, but that really talk is cheap. We really need to work together to make this new resource a reality. It's just a new number otherwise, and there's lots of numbers already. So we hope that many partners, and Johns Hopkins, we know, is a very strong partner of ours, will help to lift up this new number and help it be more recognized and used.